Let's talk about how you get an erection, right? There's blood flow into the penis through the blood vessels, and then the blood doesn't leave. So the blood goes in, the blood stays there, usually until after ejaculation, and the blood goes back. Testosterone is really important because it's like having a car that's 100% functional but has no gas in the tank. So testosterone is the primary, what we would call androgenic hormone. Do women have it too? Yes, of course they do, right? But men have it in a much higher proportion. Testosterone is really required for a lot of the masculine functions, right? So energy, muscle building, erections, the ability to engage in sexual activity as a male. You need to have it for all of that to function properly. And you can throw Viagra, Cialis, Levitra, you can do it all. But if you don't have enough testosterone or you have low to no testosterone, you will have a much lower success rate because you do need to have gas in the car. Generally speaking, as you age, your testosterone will start to decrease. And also, what we would call comorbidities does increase. So the likelihood that you might have diabetes or heart disease or high blood pressure or be taking an antidepressant, and all of those things I just mentioned can impact your ability to have the erection of your dreams. It doesn't necessarily mean that with age you will get smaller or softer, but it is a very common experience. I can't guarantee you the erection of your dreams if you're not going to be willing to do the work on your end. If they say, I'm not gonna quit smoking, I'm not gonna quit drinking, I don't wanna go to the gym, which a lot of times we do hear that, then what I have to say is, well, there are some medications we can try, but generally, you don't develop ED in a short period of time. Usually it's over time. Progressively, you will start to notice changes. And I don't expect, and you shouldn't expect, that it's also going to reverse overnight. Men will try to find a way to take as much medication as they can. But what I tell them is there's a reason why there's a limit. There's a reason why there's a maximum dosage. And if you're going home and taking 140 milligrams of sildenafil, which I've heard that a lot, that's unsafe. You have to be careful about drug interactions. You have to be careful about dropping your blood pressure too low. That's really the biggest risk because these dilate blood vessels and they can really drop your blood pressure and it can be dangerous. You could pass out, you could get dizzy. It could cause heart attacks in people who have known coronary artery disease. It can cause chest pain. It's really important to be responsible consumers of these medications so that you don't get hurt.